People experiencing homelessness are disproportionately affected by mental health, physical health, substance use issues. What we were finding is that here in Seattle, on average, people experiencing homelessness were dying around age 48, which is in line with many developing countries and is just not acceptable for a country that has so much wealth. The prevalence of use among people experiencing homelessness is estimated to be as high as 80%. That is compared to the prevalence of alcohol dependence worldwide, which is about 38%. 1811 Eastlake was really one of the first buildings of its kind in the nation. It was predicated on the fundamental belief that housing is a basic human right and not a precondition of, say, good behavior. So basically, we had an experimental group, which was the Housing First group. We ultimately ended up having 95 individuals in that condition compared to the status quo or treatment as usual. So people who had not yet received housing in this kind of model of housing. And then we asked them a whole battery of assessment questions that covered their substance use outcomes, their health and quality of life outcomes. Plus, we got their permission for us to look at their service utilization. Well, what we learned through the evaluation is that, in fact, this model of housing resulted in over $4 million in taxpayer savings over the first year. So even people who were very concerned that the public was paying for this type of housing could not argue against the fact that their tax dollars were being spent in a better way because people were not accessing ER for their general health care or, just to get out of the elements, frankly. This Housing First intervention was associated with substantial declines in drinking, despite no requirement to abstain from or reduce drinking to remain housed. And to give you an example, the median number of drinks dropped steadily. So they dropped from 15.7 drinks per day prior to housing to 14 drinks, 12.5, and 10.6 per day at the 6, 9, and 12-month follow-ups in housing, respectively. All of those numbers are really important, but I often also will say that when you talk to residents, they will cite that Housing First is the thing that saved their lives. And to me, that is more important than any of these numbers.
A managed alcohol program is a program where there's specific criteria for providing the alcohol and in a supported, structured setting.
As the pandemic became more real and we saw more cases, what we were seeing is that we have a small community hospital and we have a limited number of beds.
We knew from the little experiences that we'd had at the smaller isolation facility and in the hotel that we're really going to have this outbreak. We really need to provide alcohol so that folks aren't going into withdrawal, aren't coming into the hospital for that, and that we're keeping them isolated. And so with our program, we actually worked with the physicians from the ER. We would assess folks that came in to see what their withdrawal risk was, if they had a seizure history, and then the physicians helped create the prescription, if you will, of alcohol that would be provided at set times. We ran the quarantine and isolation facility for 8 weeks, and we served 37 individuals. 9 participated in our managed alcohol program. None of those folks left the facility, potentially exposing others. None of them were hospitalized for alcohol withdrawal, and none of them were hospitalized with the COVID symptoms. So it really was a success for us.
Our community took some of our most vulnerable individuals who were sick with COVID and provided them respectful care, a safe place to be, a comfortable bed to sleep in, honored their substance use disorder struggle. And that kind of approach in and of itself, I think, just had a really incredibly powerful impact on the clients that it served. It goes a lot to say just what being human to people who are struggling really can do in terms of engaging them in the system that might be able to offer them some more help.